This has been, I hope, a very informative and thought-provoking morning for everyone. As we are transitioning, we have a series of special topics by experts in the field to highlight specific gaps in women's health research and care. When we talk about innovation in 2025, we would be remiss to exclude the power of AI, which was even just mentioned, and machine learning, and how it's become a tool in healthcare and research ecosystem. Our first pop-up talk will be about innovating artificial intelligence to support data gaps in women's health, given by Dr. Siobhan Kelleher. She's the founder and CEO of OnaWave Medical, with over 15 years of commercial experience leading multinational companies, operating at national, regional, and global levels. Dr. Kelleher's experience extends across cardiology, oncology, rheumatology, and women's health. Recognizing that we need to treat patients, not just diseases, she completed a needs-led medtech innovation program with a view to developing a solution which will make a difference to people's lives. So at this time, if you welcome Dr. Kelleher.
Colleagues, friends, we talk about precision health, yet for half the global population, health is imprecise. As discussed this morning, women's bodies are still under-researched, under-measured, and under-diagnosed. This isn't just a once-off. This is a structural bias. Even today, only 30% of clinical trial participants are women, despite being half the population. And as Nicole mentioned in the last talk, 4% of healthcare funding goes to women's health, but less than 2% goes to female-specific conditions. We can't solve global health with half the data. AI has to serve everybody. And the consequences are real. Women are more likely to experience misdiagnosis, more likely to experience delays in treatment, and more likely to live longer years in poor health. For example, women are 50% more likely to be misdiagnosed after a heart attack. Women still wait on average 7 to 8 years for an endometriosis diagnosis. And healthy life expectancy is falling behind lifespan. Globally, women live 5 to 7 years longer than men, yet those extra years are lived in poor health. Artificial intelligence has the power to close this gap if we feed it the right data. Right now, the data is biased, fragmented, and incomplete. If we train AI predominantly on males' bodies, then we just reproduce the same inequities we live with today. But if we find the missing data, if we capture the rhythms and signals of women's health, then AI has the power to illuminate what has been hidden from medicine for decades. And this is not hypothetical. Today, technologies are being developed that can capture these signals non-invasively, continuously, and at scale. At OnaWave Medical, we are working to create a new kind of data that doesn't exist. By capturing the rhythms and the electrical signals of sex-specific organs, the prostate and the uterus, we are opening up new frontiers in diagnosis. These signals can give insights into not only fertility, but also endometriosis, prostatitis, early miscarriage, and other hormonal and inflammatory conditions. Imagine the power of an AI not trained on half the world, but on all of us. The health data gap isn't just a scientific problem. It's a solvable problem. If we act, we can make precision health truly inclusive. Let's work together to ensure the future of medicine is built on data that serves everybody. Thank you.